Hi, I'm here with Michelle Sturkey from Bronzeville Park. Michelle, thanks for joining me. I know you're extremely busy as Vice President of Clinical Affairs here at the nursing home. I just spent the morning with Tamisha and looking at your new wound rounds device that you have had for about 3 months now.
Correct.
So tell me what made you decide to implement this electronic documentation.
Well, the first reason we decided to implement this, the Wound Rounds product, is we really wanted to get a better clinical outcome with the management and documentation of our wounded patients. We also implemented it so that higher levels in the organization could really monitor what was going on a daily, weekly, monthly basis and not have our wound care nurses spinning their wheels doing reports and doing things on paper. By doing it electronically, they're obviously a lot more efficient, and we have real-time data to help us make decisions about wound care management, wound care staffing, what's going on with the resident, are there comorbidities that we need to address more completely. So it really was to improve our clinical outcomes and to give us a better management tool with some real-time data.
That's great. So the tool is really more than just a documentation device. It really is helping you really develop your whole quality improvement program.
Absolutely, absolutely. We can see real-time wounds that aren't getting better. We can see real-time wounds that have stagnated, and then get the interdisciplinary team together. The physician, the dietitian, the wound care physician, and the social worker to talk about what's going on with the resident. Is it a nutrition issue? Are we looking at someone who's now at end of life? And we need to have those end-of-life discussions. So as an IDT, along with the patient and the family, what can we do to increase the quality of life and the outcome that the patient's looking for?
Well, I think a valuable piece that I saw earlier this morning was the coordination that it provides for oncoming staff who are taking care of the patient, even the physician who may be at home and can log on to actually look at the documentation and look at a photo to make any change in interventions or change in treatments because the wound has deteriorated and you need some immediately a new plan of care. So having that available, I think, is just invaluable.
Absolutely. And it's also a great education tool for the family. Prior to wound rounds, we would describe the wound to the family, or we would try and draw a picture on a piece of paper, because most people don't feel real comfortable looking at their family members' wounds. But being able to show them the picture will not only show them a wound getting worse, but it'll also help them celebrate the successes when the wound's getting better. And it really helps keep the family informed and understanding what's going on with their loved one. And then again, lead to the appropriate discussion about what we need to do next.
And I think in this litigious society that we live in, keeping the family well informed, that circle of care of people, whoever it may be, keeping them well informed as to the progress of their loved one has never been so important. So having those photos to actually show progression and healing, or to show that the wound is deteriorating, but being able to show that you're still doing all the interventions and they can actually see what's happening, I think is just a wonderful, wonderful tool to have.
Absolutely. And the other part that's really exciting is it not only cares for the current wounds you have, but it also helps you put together a comprehensive preventative plan for those patients that don't have wounds. So we're able to do the Braden scale and look at those interventions we need to put in place day one to make sure that, if at all possible, our residents don't develop an avoidable wound. So it really helps the team focus on not only healing the wounds, but also prevention as well.
What has your staff's reaction been to using a computerized tool such as this?
Right. Well, as with any new system, at the initial onset, people were a little hesitant about how it was going to work in their daily management of the wounds. But the more they've used it, the more they realize really how invaluable the tool is. And the staff at Wound Rounds has been wonderful about making sure that the facilities are really comfortable and how to manage the wounds and how to work the devices before they set them out to be independent. And obviously that 24-hour support when the wound care nurse is like, I don't know what to do, is really invaluable. Because with any device, obviously, if they start getting frustrated, they're not going to use it.
Exactly.
So, but they have found it really user-friendly, whether it's someone who is techno-savvy or whether it's somebody who really has never touched a computer. It's been very user-friendly.
Well, I'm glad to hear you say that the company has provided valuable training and in-services, because I think you're right. If they don't know how to comfortably use a tool, then that's when they don't use it. So it's good that the tool that they've developed is excellent in this device. I was very impressed with that. So I'm glad that they have the in-service education process along with it too. I know you're very busy, so I won't keep you any longer, but I do want to say thank you and congratulations on having an excellent wound program here at Bronzeville Park.
Thank you.